Hello, Sarah Southgate, perimenopausal naturopath with a fantastic hair sticking straight up. I'm Sarah Southgate. I've worked with menopausal and perimenopausal women since 2003, and I'm here to tell you what you don't know about your perimenopausal vagina. Okay, so your perimenopausal vagina is very important to you. It is a place where many women get quite uncomfortable symptoms, and there are things that you can do, and that is what I am here to tell you all about. So settle in, ladies, and get a notebook. Well, a pen maybe. Anyway, so perimenopause affects your vagina. You probably knew that. Your vagina has a microbiome just in the same way as your gut has a microbiome. That means your vagina has good bacteria and bad bacteria in it, and that is completely normal. We have got loads of bacteria that live in us and on us, and we are learning more and more about how it affects your health. Hello, I'm talking about perimenopausal vaginas and how to look after them. So I hope it's going to be useful for you. If you've got questions, pop them on. I'll be delighted. So your vagina has its own selection of good and bad bacteria. It's called the microbiome. We've known about this for 100 years. And we also know that the state of your vaginal microbiome affects your reproductive and gynecological outcomes. So this is really important stuff. Just as your gut microbiome can be out of balance, so can your vaginal microbiome be out of balance. This is particularly significant for perimenopausal and postmenopausal women, okay? Because the decreasing levels of hormones affect your vaginal microbiome, okay? So they are detrimental to your vaginal microbiome, losing that estrogen and progesterone. Other things that are detrimental to your vaginal microbiome are antibiotics and high stress. They can all negatively impact on your vaginal microbiome. So why is that a thing? Why is it important for you to know? Well, because an imbalanced vaginal microbiome can play a role in vaginal dryness and vaginal atrophy. Vaginal atrophy is the thinning, drying and inflammation of the vaginal walls, and it's a horrible symptom of perimenopause. So this is one of the things that is going to help you to manage that, being aware of your vaginal microbiome. An imbalanced microbiome also causes itching and discomfort and frequent urinary tract infections. Also symptoms that are frequently found in perimenopause. So how do you keep your microbiome healthy? Hello, nice to see you there. Right, so avoid fragrant stuff, right? Your vagina doesn't need fragrant stuff. It smells beautiful all on its own. Stop putting perfumes, and perfumes are just toxic chemicals. Hello, Lisa. So perfumes are toxic chemicals. Your vagina does not need them. So no douches, no fragrance pads, no fragrance tampons. Who made that up that we need those things? We don't. Get non-bleach tampons, or even better, use a moon cup, because they are just made of silicone and they're brilliant. Mine is 14 years old and that's all I need. So it's absolutely fabulous. So get rid of those fragrances. Also get rid of your thongs. Thongs just irritate vaginas. Hello, I'm just talking about vaginal microbiome and how thongs not only are uncomfortable, but your vagina doesn't like them, so stop wearing them. And make sure you wear cotton underwear as well. That is really important for your microbiome, because your vagina needs to breathe. So not only should you wear cotton underwear, hello Christine, thank you for the flower. Your vagina not only needs cotton underwear, it also needs to be naked when you sleep. Yeah, your vagina needs to breathe, so don't wear stuff when you sleep, and especially don't wear synthetic stuff when you sleep, because that stops your vagina breathing, and it needs to. Those good bacteria in there need to breathe, okay? They need feeding, which we'll talk about in a minute, and they need to breathe. So What else can you do to look after your vaginal microbiome? You may know this one, and this one is wiping away from the vagina when you've done a poo, and also changing your tampons, your moon cups and your pads after a bowel movement, just to make sure that there is no cross-contamination, because that kind of bacteria is not what you want in your vaginal microbiome. That said, a healthy vaginal microbiome will keep any of those bad bacteria at bay. So that is a sign if you do get bacterial vaginosis or you do get recurrent thrush, your vaginal microbiome is not doing its thing. And if you have a dry vagina or you suffer from vaginal atrophy, your vaginal microbiome is not doing its thing because it's out of balance, perhaps. So wash your vagina only with water, okay? So none of those fragrancy things, as I've already said. Choose natural unscented lubricants. Yeah, you don't want to put a load of chemicals and fragrances on your vagina. Just don't do that. If your vagina is dry, it is really important that you do keep it lubricated, because once you get that irritation, that rubbing there, it becomes one of those vicious circles. So use lubricants if you need them. Higher Nature does a really nice one called V-Gel, and it's aloe vera based, and aloe vera is used quite a lot in skincare because it puts moisture into the top layer of the skin, and that's what we want to happen. We want to fluff this area up and keep it well lubricated. It's really important. So what else can you do to keep your vaginal microbiome healthy? You can be aware that if you smoke, that secretes nicotine directly into your vagina, believe it or not. Smoking, and I presume vaping as well, if it's got nicotine in it, secretes nicotine into your vagina, and that has a negative impact on your vaginal microbiome. And when you're in perimenopause, your vaginal microbiome is more vulnerable than it was before you were in perimenopause, before those hormones started to decline. So you need to look after it. So if you're smoking, no, you're kind of smoking into your vagina, which is a weird thing to say, but yeah, you don't want nicotine in there. Smoking also decreases blood flow, and blood flow to the vagina is really important in keeping it lubricated. So bringing lymph and blood flow to the vagina is a really important way to keep it lubricated. Nicotine is going to impair that, just as indeed it impairs the flow into your gut. Hello, Rachel. I am talking about the vaginal microbiome in perimenopause and how you can look after it. So we've covered avoiding fragrance sprays. We've covered wearing cotton underwear and throwing away your thongs because they just irritate it. We have covered, what else have we covered? Sleeping naked so that your vagina can breathe. We've covered after a bowel movement, wipe away from the vagina. Use water to wash your vagina. You don't need soaps and all that stuff. Use natural unscented lubricants and make sure that you are keeping your vagina well lubricated if you do suffer from vaginal dryness or vaginal atrophy, which is a not very nice thinning, drying and inflammation of the vaginal walls that can happen in perimenopause. Okay, we need to look after our vaginas, ladies. The next thing is, if your partner has thrush, know that they can give it to you, and they can then you give it back to them and they give it to you. So if you have thrush, that is a sign that your vaginal microbiome is imbalanced, and you need to know that that infection can ping pong between the two of you. So you both need treatment for that. And part of the treatment, especially if you have recurrent thrush, is to address what you're eating, because that impacts your microbiome just as it impacts your gut. All right. Christine says, I stopped wearing pads, I did pelvic floor exercises, and my urinary tract infection disappeared. It is perfectly possible to treat urinary tract infections naturally. I do a lot of that for people. Urinary tract infections are more frequent in perimenopause for many women, and part of that, we believe, is because the urethral sphincter, which closes, so that opening into the vagina where your wee comes out, as estrogen declines, that tissue becomes less fluffy, basically, and it means that when your sphincter closes, there's none of that extra tissue that it relied on, leaves a little gap, and then then bacteria can get in. Okay, but also things like stopping wearing fragrance tampons or using tampons can stop period pain. So there's lots of natural things we can do to look after ourselves. Okay, and the last thing is what you eat affects your vaginal microbiome. So as with your gut microbiome, your vaginal microbiome needs diet with lots of fibre, lots of coloured veg and fruit, and fermented foods, because your fermented foods are the place where you get all of your good bacteria. Hello, Victoria. Hello, Christine. Thank you for saying I'm giving you useful information. That is my purpose. I am here to teach perimenopausal people how to create their own energy and vitality naturally and sustainably. And I love to work with perimenopausal business owners particularly. So perimenopause affects your vagina. This much we know. What to do about it, we don't know so much. So I hope I've given you some tips, right, about how to eat, to look after your microbiome, what to avoid, and how to clean yourself, and a really good lubricant that you can use. So lubrication is so important. If you want to learn more from me about perimenopause and how you can address those symptoms, not just vaginal symptoms, but fatigue and high stress and low energy and weight gain, then I'm your lady. I have a program starting soon. If you're interested in learning more from me, comment and I will send you a link if you want it to my program. I'm also running a masterclass on the 25th, which is Tuesday, which is about perimenopausal brain fog. If you can't attend, the replay will be sent out. So I've got lots of options for you, and you can just follow me and ask me questions, because I do love people who ask me questions. Because it means that my message is getting out there, and I'm sharing the naturopathic love. That's what I do. So let me know if you want the link to my program to find out more about that. And let me know your questions about perimenopause, because that's what I'm here for. I'm Sarah Southgate. I'm in perimenopause too. I've got you. I'll see you soon. Bye for now.